Do you have silent atrial fibrillation? Test yourself with this checklist, created by UPOlife. Many health issues are known for being able to sneak up on us and develop without us being aware of their presence. Although, in most cases, it is about us failing to recognize symptoms and link them to any health issue. One quite serious health issue of that kind is silent atrial fibrillation. Atrial fibrillation, also called AF, is the most common type of arrhythmia. It is caused due to irregularities in the functioning of the atria, or the upper heart chambers, which then disrupts the overall blood flow. If not treated in time, AF can easily cause stroke and other heart issues. As the term implies, silent AF does not cause the characteristic signs and symptoms that usually lead to its discovery. What is characteristic of the silent AF is the fact that it is commonly discovered during a routine clinical examination, such as those that involve pulse palpation or a routine electrocardiogram. In most cases, silent AF signs and symptoms are there. They are just so mild and vague that people are not linking them to any heart condition. The silent AF can also cause no symptoms whatsoever or simply cause nonspecific symptoms. The symptoms have the habit of coming and going. One of the most common diagnostic methods used today is the UPOlife checklist. The patient and the doctor usually go through a checklist that consists of different factors and symptoms to help lower the number of potential causes. To help put an end to your worries, we compiled what we want to call the ultimate silent AF checklist. This checklist will help you to recognize your symptoms better and later consult a doctor if needed. 1. Age. Older age is a known risk factor for AF. Research shows, it is those above the age of 65 that are exposed to the highest risk of AF. 2. Silent AF symptoms. Heart palpitations longer than 15 seconds, shortness of breath, chest pain, fatigue, or dizziness are common AF symptoms. If you experience these symptoms without a particular reason, it may be a case of AF that you are struggling with. 3. Other health problems. High blood pressure, heart disease, diabetes, thyroid issues, lung disease, sleep apnea, and chronic kidney disease are potential risk factors for AF. Having a family history of AF increases your risk of getting diagnosed with the same issue as well. Additionally, heart rhythm problems can also be signs of AF. If your heart rhythm issues are present all the time, then it may not be AF that you are experiencing, but rather some other heart issue. 3. Use of medications. Have you now or in the past been taking any of the following medications? Adenosine, dobutamine, milrinone, corticosteroids, anthracyclines, or antineoplastic drugs. Science has found that certain medications, including before mentioned, increase the risk of AF. Conclusion. Silent AF is very often no silent at all. The problem is that we fail to recognize its clear symptoms in time. We hope that we have helped you to recognize what are the most common symptoms and risk factors. Learn more about how to evaluate your heart health and manage your heart condition at home by visiting UPOlife.com.